My name is Dr. Aman Bhinder. I'm a GP and an aesthetic doctor practicing in South Australia. Today I have the pleasure of speaking with Dr. Charles Runels. Dr. Runels is board certified in internal medicine and he is also a research chemist. He is a pioneer in regenerative medicine, anti-aging, aesthetics, and sexual wellness. You name it. And he's the inventor of the most famously known Vampire Facial. Not only Vampire Facial, he's also the inventor pioneer of Vampire Facelift, Vampire Breast Lift, Vampire Hair Growth, and most nowadays the most famous one, O-Shot and P-Shot. Good day, Dr. Runels. How are you doing today?
Thank you for having me. I love Australia. I was there in Adelaide a few years ago and just found it to be an amazing place. So thank you for having me. It makes me happy to know that you're there taking care of people that need help. You know, relationships are so important. Beauty is, it's always interesting to me that people will want to take care of their house or their car, but they'll sometimes feel guilty about taking care of their body. But beauty and sexual relationships, you know, Emerson said that beauty is the scaffolding of love. It's okay to take care of our body temple, and it's okay to make it a priority to take care of our love relationships. So I'm grateful that you're there in Australia taking care of people.
Thank you so much for guiding me through being a mentor. It was a lovely experience learning from, the guy who invented it. My pleasure. Yes, if you can just give us a brief overview about the vampire procedures.
Yeah, so the main thing is that we're just taking what the body normally does to heal itself. Whenever the easiest way to visualize it is everyone scraped their knee as a child and you have this scab with this yellow goo, and that goo is what causes the tissue to grow back. Well, we can take, and it comes from the platelets, so we can take the platelets out of the blood, hence the name vampire, from the person's own blood, so it's their blood, and then we take the platelets and we trick them into thinking there's been an injury and put them in a place where we want the tissue to become healthier. It's really a revolution in medicine. I didn't invent that idea of course, we were created with the platelets, and the dentists and orthopedic surgeons used it for decades because they had tissue with no blood flow. If you have there's no blood vessel going to the lining of the knee. So if you operated on it, it's hard for it to heal. So they came up with the idea of isolating the platelets. We just, in our group, myself and a lot of physicians like yourself, we're in 54 countries, and we keep developing better ways to use the platelets as a tool to make tissue healthier. And then if you take that idea, you can apply it to the face for cosmetics, to the hair to grow, or to the scalp to grow hair, and to the genitalia to help the tissue be healthier and respond better when we're having love relations. So that's the idea, using the body's own healing factors that come from the blood to propagate new tissue.
Doesn't that sound amazing? How the body can heal itself?
Yeah, it really is a miracle how it works, and we're not really doing it. The body's doing it itself, but we're able to instigate that reaction. And the reason it's so new, if you think about it, we've had antibiotics, we've had ways to surgically correct things, but it's a pretty new idea to actually tell the tissue to become healthier versus fighting an infection or cutting something out that's abnormal. All that still is needed, but actually have a tool that tells the tissue, grow new blood supply, grow new nerve, grow new collagen. That's a new idea we haven't had until fairly recently.
Absolutely. And again, like we do have a scientific backup just to support the evidence of neovascularization, that is the growth of new blood vessels, and that just explains everything.
It doesn't make anything go away. Your expert skills as a physician, knowing how to think about nutrition and hormones and metabolism and all the things that go with being healthy, it still applies. As you know, these are not magic shots. If someone's malnourished or they have an infection or something is wrong with their body, we could do the O-Shot or the Vampire Facelift all day long, and it still may not work. But when you combine it with those things, when you get the metabolism right, the nutrition right, and then you add in the growth factors from the platelets, it can be really a life-changing procedure. So, yeah, I don't want to mislead, and I know you're not, because that's what you do, but I want to make sure your patients know that everything you do is necessary, but this is just an extra tool that makes it all work better.
Yeah, no, absolutely, and that's, I guess, the whole point, how things are different, because if you're going to your doctor, they're doing your blood test, they're making sure that your blood is good enough to give you good results.
Yes.
Otherwise, it's just a waste of finances and the bit of pain that you have to take with all those needles and injections.
Yeah, and of course we're using numbing cream, so the pain is attenuated. But the other thing I think that's important about your practice is that because you're a physician, you understand handling blood. You're doing it every day, and so you know the proper protocols to keep people safe. And it's an all day, every day thing. But I think it's important that people know that if you're getting a Vampire Facelift or a O-Shot, it should be done by one of our licensed providers. Because if someone who does not understand what they're doing is handling blood, as you know, some really horrible things can happen and have happened when people pretend to be part of our group, and then as you know, like some of the inadequate devices can even transfer blood from one patient to the other, which there's no possibility of happening in your office or one of our licensed people because they have the proper devices and know the protocols. But I just want to make sure people watching your educational video here know that it's easy for someone who knows what they're doing, but they should be wary and stay away from people who are not on our directory, because they may or may not understand how to do the procedures effectively and safely.
Yeah, that was amazing. I know you're a very busy person. Thank you so much for spending some time and educating us here in Australia, and privilege to talk to you.
Oh, it was my honor. What a remarkable and amazing country, and when I've been there, the people have always been kind and smart and beautiful, and so it's an honor to be with you, and I hope it in some way helps you take care of all those people that are coming to you every day. So you have a wonderful day, and thank you for having me on your show.
Thank you. Thank you.